Hello and welcome to this special on ETV Bharat. What is the kind of challenges, like Dr. Dhillon has been saying that we have to scale up our testing, but on the rural ground, especially in rural India, at least in the urban centers, we have some kind of infrastructure for people to go and get their tests done, or probably even advocate for tests to be done at home and look at the ways of testing that can be done also. But in rural India, what are the challenges that are there that prevents testing from being done, identifying those who have the infection, tracking the person who's in fact probably gone and taken part in some gatherings that happen, because we know that this is a country of festivals. This is a country where there's a lot of people gather for festivals, for the daily market needs, for trade, and this is where we get caught up in the cycle. So what is the testing challenge actually on the ground?
True. So you must understand that currently testing is being done. If you talk about places like Raugar, where we work in, testing is being done at the community health center. That's the CHC level, right? The facility is not available at PHC or subcenter level currently. Now the challenge is the one CHC serves a huge cluster of villages, and the travel time is a lot. So people, if they develop mild symptoms initially, they tend to defer testing for a long time until unless they end up with a more severe form of the disease, ranging from moderate to severe, actually. So the problem is during that time, when they have mild symptoms, they're actually spreaders who are going around attending festivals, attending marriages, and creating clusters. To add to that, it has traditionally been seen that in India, especially in rural areas, people first seek care from the local quacks. And that's very prevalent, and we cannot deny that. Recently, we have noticed in the area that we work, in our catchment area, people have been lining up outside the houses of quacks in large numbers. That has never been seen over the past 5 or 6 years that I've been around in rural Madhya Pradesh, in this district of Guna. So that's very concerning. This rapid spread and the transmission across rural pockets is very concerning, because even if you try to manage the COVID pandemic really well in the cities, it might make a comeback from these villages and small towns when migrant laborers move back from their hometowns and villages to the cities once the lockdown restrictions are lifted. So the problem isn't solved. So we must find a
still going on in a large scale.
Precisely. And that is what
the cycle scaling down with regards to the number of infection, but the infection is there somewhere and it is spreading and we are probably not tracking it.
Correct. So I think rapid testing at the household level, by empowering our health workers, people working at the PHC, using the staff that is available at our disposal, that is there at our disposal, is the key over here. Rapid testing needs to be done on a massive scale at regular intervals to be able to pick up cases at the right time when they are actually spreading the virus the most, to encourage them to home isolate and to initiate them on treatment as and when required.
Okay, that is as and when required, because there's also this situation in India where a lot of people, even though they might be suffering from some other, like it could be a normal viral fever, but because the symptoms are there, they tend to rush to the hospital. So we don't know whether they're getting infected at the hospital because there's a huge rush over there, and or they do have a COVID or not. It's a huge confusion that's there. So good enough to actually, we don't have a proper strategy to actually educate people on what to do if they have symptoms, and when to go to the hospital when they have symptoms also.
Sure.
That's quite a challenge that we have. Dr. Dhillon, you have been, or you have rather seen Ebola Zika outbreaks in the United States and even Ebola in Congo. Now, what is the kind of health emergency that you see in India where we have to do something immediately to stop the spread? What is that first action that we need to do right away? Should be that action in your opinion?
Yeah, I think the two immediate actions that are relatively low hanging and that they can be implemented nearly immediately. One is widespread dissemination, promotion, and really encouraging uptake of these high five masks that Deva Bhaktuni was talking about. That can, I've taken care of COVID patients for months before getting vaccinated, and I had that security that I wouldn't get infected because I always had a high-fi mask on. And if you think about it, there's instances where we have a confirmed COVID patient who's coughing a lot, they have a hi-fi mask on, I have a hi-fi mask on, the possibility of me getting infected in that scenario is exceedingly unlikely. It would only be if the mask is not being worn properly by myself in that scenario. So hi-fi masks can happen immediately, and that I think is the lowest hanging opportunity, and it can almost function as something like it functions similar to a vaccine when worn appropriately and widely. Second thing is figuring out how to do restrictions. And what I mean by restrictions is lockdowns of some sort in a humane manner, whereby we're providing economic and social supports to communities. I want to be optimistic and think that can happen, but I think the experience when the first wave, when the lockdowns happened, gives me pause, knowing that a lot of the programs that India has had in place for a long time, including the ICDS, Anganwadi system, the Rural Guaranteed Employment Scheme, a lot of times implementation doesn't happen the way it should. Now, the challenge is that we might be facing a situation where there's going to be carnage if we're not able to stop transmission. And you're looking at a situation where if you don't lock down, things will be worse than even if you did with imperfect social and economic supports. But I think there needs to be a lot of focus on trying to figure out how to get economic and social supports in place so that restrictions of some degree can be put into place and rapidly stall transmission. Those are the two things that can happen tomorrow or within a week, really. And then third to that, I think to slow transmission would be trying to basically either mass procure plus or minus mass produce rapid tests and getting them out there with a lot of promotion on how they should be used, both via channels that exist in communities such as Ashas and Anganwadis, and also in places where it's possible, having people themselves self-test and then be able to self-isolate. Those are three things that can happen in a matter of days to weeks. A lot of the other things that have to happen to control this surge are things that will take weeks to months at best. And that's where we're talking about vaccination, bolstering treatment capacity appropriately. But ideally, we need to act quickly to stem the surge, while those other measures to both deal with the number of people getting sick as well as ultimately vaccinating people so this pandemic can be closed off to play out over the forthcoming months.
All right. Dev Bhaktuni, now everybody's speaking about the mask. Now, when it comes to India,
yes,
especially when the initial wave was there was a lot of people who suddenly realized the opportunity which it in fact presents. But when I listen to you, I get this feeling that including me and probably a lot of people in this country must have been taken for a ride, because on the online platform also, there were a lot of masks available. But are those masks actually effective? Do they have a standard? Is there a standard process before it goes into the industry? None of those questions were asked. Everybody was selling masks online. Everybody was making masks available on the streets. But do those masks actually protect us would have been the big question. So what do you think about having a streamlined, standardized procedure that has to come from the government, because it's a regulatory procedure? Do you think it is time for that as such? Because if those right masks have to reach the people.
No, that is an excellent question. And the masks that people are wearing are doing some good. So I don't want to give the impression that they're no good. They're doing some benefit. They've shown benefit in different parts of the world. They've done cross-regional studies showing people wearing masks get lower infection, even if they're any old mask. However, they are not good enough to stop the infection, as Dr. Dhillon was saying. And you need to have a much higher standard. And there have been efforts to come up in the United States as well, to come up with new standards for consumer masks. However, those get stuck, and those are long-term efforts that take a long time. So that's why, because a lot of people have to agree and they have to come up with a completely new thing. So using established standards like N95, like KF94 from Korea, which is available in high volumes, some of the FFP2 from Europe, or even reusable N95 masks. This is a reusable N95 mask, and you don't have to buy it again and again. It's available in India as well, and it's designed for industrial settings, and they've been around for many years. It has a very good fit because of the elastomeric surface, and you put it on like this, and like this, and you just use it for up to a year. So you can use it like this up to a year. And similarly, there's ones for like this as well. They're a little more costly up front. And so these are all things that are existing already. And so I would encourage just taking off-the-shelf products and using them today, as opposed to waiting for the future where there will be, yes, we can do better in the future, and that will take time. But there are many good alternatives That if you go to patientknowhow.com, I've actually curated a number of them, that you can check. And
in fact, the most commonly available are the surgical masks that are available.
Yes.
And that is what most of the Indians have been, in fact, been having with them. Also,
Yes.
a critical question that they ask is, how long can you use an N95 mask? Like, when do you go for the next replacement?
That is also an excellent question. And, there's no good answer to that. Even the CDC in the United States doesn't have a good answer to that. They found in practice, it can be used for quite a bit until it's unusable or it's not. It all depends. Your mileage will vary. If it's a mask like this, designed for reliability, oil can fall on it and it still works. That's for like heavy industrial air. You can use it for even up to a year. But if it's a disposable mask, it may last much shorter. So it all depends on how often you need to use it. If you're maintaining it and it's available to use, you can use it. And the surgical masks is a really excellent question. Some of them have a good filtration, but what you can do is you can buy something called a fitter. And then because these masks don't have a good fit, they're very loose. You put this fitter on and it provides a seal around the face so that it clamps to the face like this, elastic material. Okay. And that actually can make you a very effective mask. In fact, you may have most of the material already in your hands. You just need to use a fitter. You can make it yourself or you can buy it online. And so that's actually a very scalable and immediately actionable solution, better than double masking.
Well, one of the challenges that I have seen is that when it initially came out, I don't think so anyone had this kind of knowledge about what are the kind of masks available, the standards available. And I can vouch saying that most of them were just simple cotton masks that was in fact there. And most of them are using it even now. That is the kind of mask that is available and is being sold, saying that, this is the situation. And another challenge that we have is that you need to produce masks for such a huge population. So people tend to, in fact, look at the cost factor. At the same time, if they have to replace it, that also becomes a cost factor. And the right masks are not reaching. So this is the biggest challenge that I have seen on the ground as of now. So as a person who has been promoting hi-fi masks, where do you think, where we can rope in our cottage industries or we can rope in our small-scale industries so that we can actually scale up production of this? Do you think that is the way forward for something like this, where we can actually, on patent production or on licensed production, we can in fact go ahead and scale up this process so that at least people get the right mask? Is that a possibility?
Definitely. And in fact, there are so many alternatives. And in fact, US manufacturers are actually, say they have excess capacity, and some of them are actually sending them to India right as we speak, to the Delhi government, and they're starting to send massive shipments, millions and millions of masks. And so they're actually quite available. It's more a question of market demand. If people recognize they need it, there are many alternatives they can find. Even the surgical masks already they have in their hand, if you can add it with a fitter, you have close to an N95 mask in your hands. It basically, if you put this on and then you add this fitter, there's no question that you can make enough of these for the Indian population. It's more a question of what is the type of mask you need, and how do you get it? How do you get people to use it? And the important thing is using it is also so there are many manufacturers and a large industry ready to do this for you. So they think of it that way. There's not a huge supply constraint. There's actually a demand constraint. And that's what we're trying to change. We're trying to say, hey, just everybody, if you have a well-fitting, high filtration mask, it's almost like having a vaccine when you're wearing it. And in fact, for future variants, there are now more contagious variants believed to be circulating in India that are spreading much faster than the previous ones. And these masks work just as well for any future variants as well. So it's actually better than a vaccine.
Well,
in that respect.
Quite interesting insights, which I would like to take to Adrish Bhadra. Adrish Bhadra, you have seen how people have been masking in rural India. You have seen how those challenges have been. Most of them try to just have a cloth around their nose, and they try to have at least 2 layers of it. And they say that is what should be the case. And there have been instances in which even some officials in the government have encouraged going ahead with that. Just some kind of coverage. But over here, we get that insight that you actually require a standard mask to prevent this. It's not that you just make a make-ready sort of thing from local available fabrics and do it. And you require some kind of scientific thought being put into it, and you need a proper product. But what do you think is in the rural sector? What are the challenges that when it comes to just distribution of masks that we are facing over there?
Well, I think in the rural areas, there has been the chronic problem of using high quality masks all through. N95 being relatively expensive is not something that people in the rural areas can afford every now and then. In the urban settings, however, there is a good uptake of N95 masks. In the rural areas, I agree with what you've been saying. They generally tend to wrap a cloth around their face, and I think people who have been enforcing the law, the police, haven't really been very strict when it comes to use of such masks, because the idea is to just have something on your face. Right now, the idea is to have just something on your face. As long as you're doing that, you're not being penalized. But I think that needs to change. I understand the limitations that are out there in the rural areas in terms of purchase of masks and the availability. But I think I agree with Sri to an extent. The supply side may not be that much of a constraint. The uptake of surgical masks in rural areas has to be there. Surgical masks are much cheaper. And DIY, like do-it-yourself mask fitters, along with distribution of surgical masks or purchase of surgical masks, I think would be the right thing to go ahead with for rural areas.
Mm-hmm.
So we are actually looking into this possibility. We are trying to push for surgical masks and mask fitters in rural Madhya Pradesh. And let's see how that turns out to be.
Okay. Dr. Dhillon, now you saw the challenges, you heard the challenges that we have, especially on the mask front. And that mask is supposed to be one of the primary defenses against this particular pandemic. If that is going to be our challenge, and then coupled with our vaccination program that is also going a little haywire at the moment, what is our situation at the moment? I mean, it's an honest question that I'm asking. What is India's situation? Is there something that we can actually work on, or are we actually going to say that, hey, we have had a problem and it's going to be problematic for a few days, and maybe only if corrective measures are initiated as soon as possible will there be some kind of a difference in the coming days? Because all these are challenges for us at the moment.
Yeah, certainly this is a catastrophic emergency across the board. So that's where we are, and that's not just in one or two places. It's in a lot of urban centers. And as Dr. Adrish is saying, it's now penetrated very much to the rural periphery too. To me, though, the situation is what it is, but there are actions that we can take, as we've been discussing, immediately to start pushing back on this. And there are solutions that can happen. So, talking about the hi-fi masks that are N95 caliber, for example, and, the supplies are there. If they're not accessible, surgical masks are pretty ubiquitously available. A lot of these mask fitters, as Dr. Dharish is saying, there are versions of them that you can develop that are do-it-yourself, that you can use locally available materials to develop. And in fact, with some colleagues who have developed some of the first mask fitters, a group called Fix the Mask, Dr. Adrish is actually looking at locally available supplies that communities can then actually create the fitters themselves. And so that's something that in a matter of days could be scaled up. So I think what really needs to happen first is, there's a little bit of a deer in headlights moment where there's a massive crisis and it's sort of, a million things are being said about what should be done, what needs to happen. And I think what needs to be a first step is getting clarity to that discussion and coming up with a very kind of clear framework of saying, these are the things that we need to do. And then systematically and strategically figuring out how they're going to be executed. Mm-hmm. It's the same kind of thing that, when we jumped into the Ebola epidemic in West Africa several years back, it was, not anything like the level of catastrophe that we're seeing here now, but it was a precursor to it. But it was this thing where, there was a widespread panic. There were a lot of different ideas of things that, of course, could help. But what you really need to do is corral that and clarify it into a coherent strategy, and then systematically go about implementing that. And I think that's the moment we're in now. We need to, rather than sort of piecemeal grabbing different things, throwing different things at the wall and seeing what sticks, take account of what we know can work, what is effective. At this point, the science, the technology is not the limitation in stopping this pandemic. We have had that for almost a year. And even, countries that previously would have been thought of to have been able to implement that well didn't do it well. US, but also a number of European countries are a clear example of that. We know what can be done to stop this. Let's now figure out very clearly what those interventions are, What is the plan to be able to execute them and systematically go about making that happen? And so certainly at a federal level, yes, you need political support to see that happen. And even more so at a state level, you need to see that driven, because that's really where execution happens. But even when that is not quite happening, it's not something where you sit and wait for the politicians and necessarily for the government to step forward and do it. One is there should be pressure on government to do it. But second to that is taking initiative locally too. There's phenomenal actors in all communities, whether they're part of the local government system or part of nonprofit systems or part of just community groups. They're in place. So for example, something like masks, that's something that can be launched in full. In fact, Dr. Drees is working around seeing how local groups who have some craft skills or other manufacturing skills can even start mass producing mask fitters, even for the immediate area. And with the supply of surgical masks there, that can happen very quickly. So, you know, it's a crisis. There's a lot of reason to be alarmed. The trauma of the crisis is something that people are processing. Almost, it's like you're in shock, yet you have to do very hard and decisive action amidst that shock. That's where we are. But I think we're in a moment where I think we can take a pause, get clarity on the strategy, and go ahead and full force implement that through whatever channels are there. And I would say through all channels that are there, government, nonprofit, etc. This can happen. And it's a matter of, I think, getting that strategy clearly in place and then letting the local level leaders, district, block level, figure out how to execute with ideally support from the state governments.
Well, in fact, I'll give the last words to Devbhaktuni Sri Krishna now. Well, this is our challenge. This is what we are going to do. And we require people on the ground, entrepreneurs or common people who would like to take this challenge out. So how do you think that the government should go forward, especially with just mass manufacturing? Because that is the first thing that we can actually get people to buy, and we can give people much before the vaccines can come. So what is your opinion, or what is your suggestion to actually meet this challenge?
Excellent question. We need to use the solutions that are available today off the shelf from existing manufacturers that are actually available, that they have excess supply already. You need to take the N95, the KF94, the FFP2 from wherever it's available and bring it to India, start using it to stop the spread. And separately, the mask fitters is an excellent concept. This is taking surgical masks that are available in great volumes already. And I'm wearing it right now. This is a mask fitter from US by a company called Fix the Mask. What it does is before I wear the mask, my eyeglasses are fogging up. After I wear the mask, no more fog. It has sealed my face very tightly. This is all pretty much as close as you can get to an N95 type protection using a surgical mask. And so it's an excellent thing. This can be manufactured locally very quickly to just enhance the fit. I think if you just take what you're already doing and enhance the fit, you'll have the protection that you need to stop the spread. So it's, in fact, the local entrepreneurs can start making fitters. There's an open source design on their site, Fix the Mask, that they can be spread. This is also manufactured. They're going to scale up the manufacturing. So really focusing on fit and filtration, and we can get out of this pandemic.
Well, fit and filtration, and therefore we have to in fact bring our Indian ingenuity into it, and also our resolve to fight against this pandemic. It's been one of the biggest challenges,
and scaling it up
after our independence, and we are all in fact trying to ensure that India does see a good future, and the current crisis can in fact be mitigated as soon as possible, and probably our citizens remain healthy and they are able to in fact also pass on whatever they've learned during this second wave to those countries that in fact require it also. So hoping that we'll be able to in fact go ahead and contain this pandemic. Thank you, gentlemen, for in fact speaking to ETV Bharat. It's been quite a pleasure to speak to all of you all and get your insights with regards to the current pandemic.